Have you got any examples of patients where you've given them testosterone treatment in some form? You've done something to increase their testosterone, and you've seen a remarkable reported difference in their sex life?
All the time. Yeah, so first let's backtrack. There's two ways to give a person testosterone. Uh, if I give a young man testosterone, remember, it causes infertility. So you would never give someone testosterone if they're planning to have children, right? That's very important, right? So I have two ways to raise their testosterone. I can give you medications to raise your natural testosterone. There's several. There's a pill called clomiphene citrate. There's HCG. I can use medications to raise your own natural testosterone, and they preserve your fertility. The second option is I can give you medications like testosterone. There's 7 of them, but they will shut your natural production down. Not only will they shut your natural testosterone production down, but they will shut down your sperm production. Now, if you've already had your kids, you're 60 years old, your testosterone level is already low in the first place, what are you preserving? Okay, it makes a lot of sense. And there's 7 ways to do it. My favorite way are the injectables and the oral testosterone. They are fantastic. Oral testosterone is quite interesting. First of all, testosterone was invented in 1935. This is not a new drug. 1935. And oral testosterone initially was feared because it would actually cause liver toxicity and liver cancer. And it wasn't until the 1970s when they were able to make oral testosterone undecanoate. And what's nice about undecanoate, it bypasses the liver, no cancer, but it had to be taken 3 to 4 times a day. It was available in the UK as a drug called Andriol, all over the world, but not the US. The US, we did not get our first oral testosterone till 2019. And then 2022, we received 2 more. And now we have Tilando, Jatenzo, and Kysatrex is our oral. They're taken twice a day with a meal. What's nice about Kysatrex, it's actually available in the UK. So in the UK now, they can actually get Kysatrex as well. But oral testosterone, most patients don't mind taking a pill, and it seems very easy to do.
So should someone like me be taking testosterone?
If your levels are low
Yeah.
and you're symptomatic, and I think that's very important. If a man comes in with low levels of testosterone and says, I feel great, I have no symptoms, I said, I'm not giving it to you. These are the symptoms: low energy,
Yeah.
low libido, erectile dysfunction, decreased muscle mass, increased fat deposition, poor sleep, and depression. These are some of the common symptoms you'll see. Most sensitive symptoms are the sexual symptoms: erectile dysfunction and low libido. So if he says, I have these symptoms and my levels are low, and I recheck it and confirm that it's low, that man is a candidate for testosterone therapy. But if he's young, hasn't had children yet, I'm going to say, look, let's hold off on giving you testosterone and use medications to make you make testosterone. And if you don't want to take medications, actually, there are many things you can do on lifestyle modification to raise your testosterone. We talked about weight loss as well. So let's live in this area here. You are too young to take testosterone now. But conversely, let's say a patient comes in and has every single sign and symptom of low testosterone, but his testosterone levels are normal. I'm not giving him testosterone because it could be something else. Maybe he's depressed. Maybe he has a low thyroid. Something else is going on. So you must have signs and symptoms and a low T level to be a candidate. And if you fit that, then you may benefit.
What about women?
So this is important. In 1935, when testosterone was invented, it wasn't many years later till they actually started using testosterone in women. And early reports of testosterone in women were actually quite remarkable. The earlier manuscripts describe improved quality of life, improved libido. And if you and I walked into the drugstore today and said, give me the testosterone for women, it does not exist. There is not a single FDA-approved testosterone for women in the United States, but we have well over a dozen for men.
Can you explain this to me, just because I want to make sure I'm
Yeah.
clear? Why would a woman take testosterone? Because when I think of testosterone, I think of men.
Yes. So women make more testosterone than any other hormone in their body. They make more testosterone than any other hormone in their body, right? And when women have higher levels of testosterone, they tend to see a greater improvement in libido, muscle mass, bone mineral density, sense of well-being. Some have reported improvements in cognition. As the testosterone level goes down, we start seeing these symptoms, particularly low libido. If you give a woman back her testosterone, many of these women see a significant improvement in their libido. But the issue is that we don't have an FDA-approved product for testosterone in the United States. I think in the UK you call it off-license. We call it off-label. Now, in the UK, they did have one. They had a wonderful patch called Intrinsa. And the women in the UK could get the patch for testosterone, go into the drugstore. NHS covered it, and it was fine. Then they had Androfem, and Androfem was actually approved and now no longer is approved. So now in the UK, you also don't have an on-license medication. You can still get Androfem from Australia, but unfortunately, it's very difficult to get. So what do? We use the drugs for men and we give it to the women in 1/10 the dose. That's all we do. So if we have a packet that a man puts on a day, we say use 1/10 of the packet every day for the women, and they can see significant improvements. It is not illegal to give a woman testosterone. It's just considered off-label or off-license. But they see significant improvements.
In what?
Sexual function by far the most. Libido goes up, no question. Many women report that. Muscle mass. If you think about testosterone, bodybuilders take testosterone for a reason. Why? It significantly improves muscle mass. It can decrease fat deposition. Many patients will report improvements in cognition. It can help with bone mineral density as well in men and women. And I also believe in depression. So I think testosterone does help with depression. I just want to make a very important point. Testosterone is not just about sex. There are 5 other things that you need to think about in men and women, and I want to talk about those. Men with low testosterone levels are much more likely to have a heart attack, non-negotiable. Men with low testosterone levels are much more likely to have diabetes, obesity. Men with low testosterone levels are much more likely to suffer from depression. Men with low testosterone levels are much more likely to have a bone fracture. So it's not just about sex. It's about their overall health. And if you were to check one blood test to assess a man's overall health, it's his testosterone level. One blood test to check his overall health. It would be because it affects heart, diabetes, obesity, bone mineral density, energy, muscle mass, erections, libido. One blood test. I can't think of another blood test that is a better barometer of overall health.
I want to get clear on something because I've heard people talking on my podcast before about HRT
Yeah.
and women taking HRT because of menopause and things like that. Does HRT have testosterone in it?
No. So typically when we say HRT, we're talking about estrogen and progesterone, typically.
Yeah.
And typically when we talk about TRT, testosterone replacement therapy, it's a little bit different. In a woman, there's something I call the triangle. And it's just basically estrogen, progesterone, and testosterone. Just simple. And if you have a woman who's deplete in estrogen, testosterone, and estrogen, progesterone, testosterone, and replace it, many of those women feel better, right? So many of them do. There are other hormones that are also important. I call it the outside circle: cortisol, thyroid, growth hormone. We look at those as well. And so I think those are also very important. And I tell them, we're going to optimize your hormones, but we're going to optimize your medical condition, but that is only 50% of the story. The other 50%, again, is diet, exercise, sleep, and stress reduction. And if you do your part and I do my part, we're on fire. We're absolutely on fire, but you have to do your part. Same with men. I put you on the testosterone. I optimize your medical conditions. But you got to exercise. You got to eat right.
Why aren't women being prescribed testosterone then?
Right, because it's considered, well, in many countries, in Australia it's available, in the UK it was available, and many women are being prescribed testosterone.
Okay.
It's just off-label.
It is the first time that I've seen someone on my show anyway really emphasize the point that testosterone isn't just for men, it's for women as well.
And it can significantly improve their quality of life.
Talking about testosterone, one of the big conversations that's rattling on the internet is about this decline in male testosterone over the last couple of years. What exactly is that decline, if you had to sort of quantify it?
If you look at the original studies, we call it the Framingham Heart Study back in the 70s, testosterone levels were roughly around the 700s. Average men between the ages of 18 and 40 were around the 700s. And every decade, we're starting to see a decline almost by 50 nanogram per deciliter. And so the latest, in the 2015 numbers, are roughly in the mid 400s. So we've seen almost a 300 nanogram per deciliter decline in serum testosterone, which is significant because it has 2 implications. It's not just about the way you feel and energy, muscle mass, erectile function, but that low testosterone can have implications on fertility. That's really important. So we didn't talk about that, but fertility, sperm need testosterone. Low testosterone decreases your sperm count. Sperm counts have also been on the decline as well. So, I think it's really a testament to the fact that decade by decade, we're becoming a more unhealthy population.
Do you think that's really the heart of it? Is this sort of our diets and the way we live and becoming more sedentary, less exercise, more processed food, etc.? Do you think
I
that's the heart of
I
it?
think that's the key. That's absolutely the key. The types of foods we eat, the processed foods that we eat, high fructose, high carbohydrate diets, and if you and the way we know that is just look at the obesity, look at the diabetes. There has to be a reason why it's on the rise, right?
And on that point of fertility, I'm in a season of life where I'm going to be trying to have kids pretty soon. What's the most important things I should be thinking about from a lifestyle perspective, in your view?
Yeah. So I tell patients Darwinism. In other words, survival of the fittest. Healthier people are more fertile, right? You're passing on the genes. So essentially, we tell patients the number one cause of infertility in the world for men is a varicocele. A varicocele is the swelling of the veins around the testicle. You know how women sometimes can get swelling of the veins in their legs? You see those veins that are kind of obvious? Well, men can get those veins dilated around the testicle, and those varicoceles can impair sperm production. Now, 15% of men in the world walk around with varicoceles, but up to 40% of men with infertility will have varicoceles. So it's really important to assess for the varicoceles. But lifestyle modification, each one again, diet, exercise, sleep, have been shown to help improve fertility in men as well. So I say healthier people are more fertile. I need you to start getting healthier. That's very important. We raise the testosterone level in many of these men naturally. We don't give it to them to help improve their fertility as well. But Stephen, check your semen analysis. That's the simplest thing
I've
you can
done
do.
that.
Check it,
I
right?
did that.
Yeah.
Uh,
It's a great predictor. It's not just, there was so many amazing studies showing that a semen analysis is a phenomenal predictor of overall health. Many studies showing that if your semen analysis today is impaired, it's a predictor of you having comorbid conditions today like diabetes, obesity, metabolic syndrome. It's also a predictor of cancer. So we know that if you have infertility, you're at a higher risk of having testicular cancer than those that don't have infertility. And it's also a predictor of who will have problems in the future. Mike Eisenberg once showed a very nice study. Men who have low sperm counts can have a 30% increased risk in diabetes, 50% increased risk in ischemic heart disease in the future. Tom Walsh showed those men could have 2.5 times higher risk of high-grade prostate cancer in the future. So again, to me, it's just a marker of overall health. Check the semen analysis.
I did that, and I was actually, to be honest, I was really quite nervous about it because as someone who's in my early 30s and wants to have kids, I was really scared that it would come back and say that like my sperm is um, dysfunctional, and
Yeah.
I've got a huge amount of empathy and feelings for people that do those analyses and get bad results back.
15% of all couples in the world, 15% suffer from infertility. That's a lot. And if you think about it, 30% of the time it's a male factor, 30%. 20% of the time it's a male and a female factor combined. So indirectly, a male is involved 50% of the time when you have in an infertile couple. And it can be devastating for that couple. I mean, psychologically devastating. And what's also interesting is that most couples, 50% of couples don't seek therapy. And of those couples that do seek therapy, this is globally, only 25% of those couples actually go forward. And so I call this a group of individuals that also suffer in silence. They should know that there are excellent treatment options available.
This graph that I had printed out is just shocking to me. It's going back
Yeah,
to the point about testosterone, but the really shocking thing is how quickly this has happened.
yeah,
Because this is the year 2000, and this is the year 2015, 16,
yeah,
yeah. And the decline there is from roughly 600 nanograms, is it?
yes. Nanogram per deciliter.
Nanogram per deciliter to roughly, for some age groups here, 400
Yes,
nanograms per deciliter. And that's only in 16 years.
yes.
So if you play that forward another 16 years, there's going to be a bit of an infertility crisis.
There is. Fortunately, on that graph, it's plateauing a little bit, which makes me feel a little comfortable.
Okay. Oh, yeah, it is actually.
It's
Yeah.
plateauing just a little bit, but you're right. It could be a significant crisis. And again, as I mentioned, it's the adolescents, the younger folks, who are having the greatest rise of obesity. And that's where fertility comes in. Because obesity in someone in 60s is not concerned about fertility. But a young patient who has obesity will have a higher risk of infertility.
If you're an entrepreneur, you're probably going to want to listen to this. It's a message from one of our sponsors on this podcast, which is LinkedIn. If you've listened to me on this podcast for a while now, you'll know that I've been on a bit of an evolution as a business owner and entrepreneur. And one of those evolutions that has become clearer and clearer as I've matured is that the single most important thing in building a business, in building a company, is hiring. The definition of the word company is actually group of people. And that is the first responsibility and job that any entrepreneur has and should focus on. But surprisingly, most don't. About 80% of my team have been hired from LinkedIn. And I think there's very few platforms, if any, in the world that could give you that diversity of candidate with that much information and data on their profiles. It usually costs money, but for the entrepreneurs that are listening to me, I've got you a free job ad post for your company on LinkedIn. Just go to linkedin.com/DOAC to post your free job ad today. That's linkedin.com/DOAC. Terms and conditions apply. If me and my partner came to you and we said, listen, we've got sexual problems in the bedroom, what are the steps that the things you'd look at that we haven't focused on so much today? Is there anything in particular you'd say, okay, and I'm trying to stay away from being prescribed a pill, so I want to do anything natural I can before I get to that, and then we'll talk about some of the other more drastic measures one can take.
So let's talk about natural things, because everyone wants to know about what's the natural things I can do. So when we talk about diet, there's certain diets that have been helpful to improve sexual function. For me, it's the Mediterranean diet. The Mediterranean diet is rich in whole grains, legumes, fruits, vegetables. And if you look at red meat and sweets, it's once a month. If you look at poultry, it's maybe once a week, but mainly fish. Those diets have typically been anti-inflammatory diets. Many studies have shown that that diet can significantly improve erectile function. And one study, the MEDITA trial, actually showed that it improves sexual function in men and women. So I'm a big believer in using the Mediterranean diet. When Esposito did her first trial, it was a prospective trial, 110 obese men. 55 men get the Mediterranean diet. 55 men don't get any intervention at all. She follows them prospectively for 2 years. What does she find? Not only a significant improvement in endothelial function, remember that lining of the blood vessel, but a significant improvement in erectile function in these men. No Viagra, no pills, nothing. Simply changing the diet improved the erectile function. And the same with sexual function in women. So that's an important one. The second is sleep. Let's talk about sleep. So studies show that if you're getting less than 6 hours of sleep a night, it significantly increases your risk for sexual dysfunction in men and women, right? Your ideal amount of sleep should be 7 to 8 hours. Now, let's say you say, well, that makes sense. Maybe I'm going to get sleep for 9 to 10 hours because the more sleep I get, the better my sexual function. But that's not true. It plateaus. So if above 9 hours, it does not increase your ability or sexual function. So 7 to 8 hours of sleep a night, I need you to get. Third is I really need you to focus on exercise. So I published a very nice study looking at, it was a meta-analysis on how much exercise one needs and what type of exercise to actually improve erectile function. In this study, typically you need 160 minutes a week, so 40 minutes 4 times a week for a course of 6 months of moderate to severe exercise, vigorous exercise. And so most people can get 160 minutes in a week of exercise, but that's getting your heart rate up and doing the exercise. Significantly improved erectile function in men if you did that. And the more severe your ED was, the greater improvement you saw in erectile function strictly by exercise alone. No other intervention, Stephen, just exercise. So here you have a patient that now starts doing some exercise, starts sleeping better, starts changing the diet. It's all additive. You are now significantly improving erectile function just by lifestyle modification alone.
Pretty profound that exercise can have such a big impact, isn't it? Is that the same for women?
It is true because many of the things. So unfortunately, once again, the research we have in women is not close to what we have in men. But the MEDITA trial was also in women. The sleep studies were also in women. And so these studies also show that sexual function can be improved with sleep and with diet. I think that men and women are not that different. I mean, if you see a significant improvement in a male sexual function with diet, exercise, sleep, you can also see it in women as well. Actually, there was a great study. This looked at 110 women, and they had coronary artery stenosis. They did angiograms on 110 women, and they showed that the greater her stenosis she had, the worse her sexual function. So the greater the blockage in her heart, the worse her sexual function. They put those women on a cardiac rehab program to actually improve their cardiac function. So a diet and exercise program. And those women that actually were through the program, 4-fold increase almost in their sexual function.
What, 400%?
4-fold. Yes, sorry, because we use a questionnaire called the FSFI, which is a questionnaire. So a significant improvement in sexual function just on improving cardiac function. So remember, cardiac function and sexual function are related, and it's bidirectional. You improve one, you improve the other. It's very important. We talked about this earlier. 40% of men in the world at 40 will suffer from erectile dysfunction.
40%?
40%.
Jesus.
50% at 50. 60% at 60, 70 at 70, 80 at 80. You do the math. It essentially is a very prevalent condition. This condition is associated with increased cardiovascular events. It's the first sign of a heart attack. We talked about that. This condition is associated with 2.5 times more likely to be anxious, 3.5 times more likely to suffer from depression. And this condition is also associated with diabetes. In other words, men with ED, 2 times more likely to have undiagnosed diabetes. And yet, only 50% of men even talk about it because they're so embarrassed. So you show me another condition in the world that affects more men's lives, that's associated with more adverse conditions, and they're too embarrassed to speak about it. They suffer in silence. There's not another condition. There's not another condition, but yet we're embarrassed to discuss it. I used to give these lectures, and I would look out to the audience. I'd say, please raise your hand if you suffer from hypertension. And many people raise their hand. They have high blood pressure. And say, okay, please raise your hand if you suffer from sexual dysfunction. No hands go up. But statistically, you know that over 50% of those people had sexual dysfunction. So why is it okay to raise your hand if you have hypertension, but not okay to raise your hand if you have sexual dysfunction? It's got to stop. We have to destigmatize. It's okay to have sexual dysfunction. It's a common condition. It's curable.
Why don't men raise their hands from a psychological standpoint? Why is that?
I think they're embarrassed.
Why?
I think that historically sexual dysfunction looks as like a weakness. I'm not a man, less of a man. You know, you have hypertension, it doesn't mean you're less of a man, right? But they have this assumption that it's a weakness, less of a man. And I think that it's okay. You have to be comfortable saying that you have sexual dysfunction. There are amazing treatment options for sexual dysfunction, amazing, that work very, very well. You just have to raise your hand and let me know that you have it. I just want to make one other comment about diabetes. There was a study that came out of St. Louis looking at young men, 18 to 40 years old, and they were screening them for erectile dysfunction. And what they found was when those men came in for erectile dysfunction, 30% of those men had prediabetes or diabetes on that day, on the day they were being diagnosed, 30%. Wow. And I thought to myself, young men do not go get screened. I remember when I was 30 years old, I didn't go in for my annual blood pressure check and my annual sugar check. There's no way I'd get my glucose checked. But if a young man gets erectile dysfunction, he is at my front door first thing tomorrow morning. They show up. That's the first thing they're going to do because it's a very big condition to them and they want to get treated. And that is the opportunity to treat these young men and treat the condition. If you see a young man or someone who comes in for ED and you screen them for diabetes, and I catch the diabetes at 30 as opposed to 40, that is 10 years of damage on the vessels that you're saving because you catch the disease early. So ED is the gateway to men's health and to treating men early before it's too late. So I really use sexual health as a tool, a vehicle to improve overall health because men take sexual health much more seriously, particularly young men.
If you love the Diary of a CEO brand and you watch this channel, please do me a huge favor. Become part of the 15% of the viewers on this channel that have hit the subscribe button. It helps us tremendously, and the bigger the channel gets, the bigger the guests.